If you're confused by Medicare, it's about to get worse. So I'm bringing you the ultimate Medicare guide for 2024. Today we're talking with Melinda Caughill about Medicare, the ultimate guide to Medicare for 2024. Welcome to the show.
Thank you. Thank you very much.
Well, I brought you on the show here because I met you at a financial planning association meeting. You're telling us all about Medicare, full of crazy good knowledge. And I thought this is a Medicare open enrollment season. It's the fall. Everyone cares about Medicare right now. Seems like they don't care about it the rest of the year. I got a feeling they should care about it the rest of the year. But just
I
tell me a
should.
little bit. Yeah, just tell me a little bit about what it is you do and maybe how you got into that line of work.
It's actually fascinating, but not fascinating to me at all because it's literally my life. My mother is my co-founder in my company. So 65 Incorporated and I-65 are our companies. We do not sell Medicare insurance. Everything we do is on a fee-for-service basis where we provide guidance and recommendations to our clients, but we work for our clients, not for insurance companies. So my mother is a nationally recognized Medicare expert of decades. When I was growing up as a kid, she started her first company in the basement of our home. Uh, Basically helping the nation's home healthcare agencies and long-term care facilities understand how to comply with changing Medicare regulations. She actually grew that company into a multi-million dollar business that she exited in 2008, just before the recession. In those decades though that she did that company, she swore that she someday was going to help the consumer with Medicare decisions. So we started 65 Incorporated in 2012 with that explicit goal of helping clients, normal everyday people, understand Medicare and the decisions that they're making so that when they needed health care at the end of life, they wouldn't be locked out because of decisions that they made previously when they turned 65. So that's what we do.
Yeah, and it seems interesting because hopefully you make it to 65 and then you're all in the same boat. Like everyone's 65, everyone signed up for Medicare at the right time. Um, you don't hear terribly too many horror stories going into 65 other than, oh my goodness, everyone's calling me and I get all this mail. It's like stacks of piles high on there. But tell me a little bit about what you've seen in terms of, I don't know, not Medicare mistakes, but Medicare horror stories of what's going on that Americans are missing out when it comes to Medicare.
So, do we have beer? Do we have alcohol? Because we have more horror stories than we would ever need or want. Basically, we see the worst of what happens. And inevitably, what happens is people did not make the appropriate decisions when they turned 65. Inevitably, it all boils down to when they first made decisions. That is the one common thread in all of this, is that when they first signed up or first made their decisions to enroll in Medicare or delay Medicare, something was missed, some mistake was made, some assumption was made. And as a result, now all the dominoes are falling incorrectly and very often are costing people by, number one, in money, or number two, not being able to get the healthcare services they need when they need it from the providers that they need it from. So it all comes back to essentially making an assumption about Medicare that was not specific to you. And in fact, I will teach you my golden rule. When it comes to Medicare and making Medicare decisions, people like to give you a silver bullet, right? A magic bullet. Hey, everybody has to something, something. And typically the something, something I hear is everybody has to get enrolled in Medicare when they turn 65, or everybody who's still working doesn't need to do anything related to Medicare, or whatever it is. It always starts the same. Everybody has to. Okay, so here's my golden rule. The golden rule is the only thing in Medicare that is true for everyone is nothing in Medicare is true for everyone. And I am not kidding. I can go point by point by point. You give me some everybody has to statement, and I will tell you the exception. Without a doubt, there is an exception. And what happens is people wind up being those exceptions, and now everything goes wrong.
Mm. So as you're approaching 65, what should you be doing to get ready for Medicare?
Taking a look at your unique situation. I don't care what assumptions you think you should be making you are about to turn 65. Don't look at the mail pieces. Don't do what your friend did or your spouse did necessarily. Take a look at your own unique situation. Um, so basically, what we like to do is when it comes to approaching Medicare eligibility and enrollment, most people believe Medicare enrollment is a 3-step process, with step 1 being choose plans. United Healthcare, Humana, Aetna, Blue Cross Blue Shield. Choose your plans. Once you've chosen your plans, then you get enrolled in Medicare. Get your Medicare card in the mail, and then using that Medicare card, you sign up for the plans you initially chose. That's what insurance companies want you to believe the Medicare enrollment process is, because that speeds them right into selling what they sell and moving on to the next sale. But that is not how Medicare works. This is Medicare, a government program. Of course, it's not as simple as 3 steps. Come on. Medicare enrollment is actually 6 steps. And I would argue all day long that the 3 steps that are invisible to most people are actually the 3 most crucial. So let me teach you all 6 steps. Ready? The first step of Medicare enrollment is not picking plans. No, good heavens, no. The first step of Medicare enrollment is timing. Do you enroll in Medicare at age 65 or do you delay? Don't make assumptions. Don't listen to silver bullets. Actually take a good look at your own unique situation and make decisions from there. Step 1 is timing. Step 2 of Medicare enrollment is still not picking plans either. Step 2 is determining your Medicare path. And when I say path, technically what I'm talking about is the type of coverage that's best for your unique needs. But we prefer to use the term path because I want you envisioning yourself standing at a fork in the road. You're choosing from your different path options, which could be original Medicare with a Medigap policy and a Part D drug plan, or Medicare Advantage. Those are the 2 major ones, but there are also retiree coverage paths, military TRICARE coverage paths, or federal employee health benefits paths. I have had 2 clients who've had all 5 path options
Mm.
available to them. So what you do is you choose the path that's best for your unique needs, knowing that the path you choose, you may not be able to change later in life. This is often a one-time permanent decision. So timing and then path. Once we know those, then we can go ahead and choose specific plans. That's step 3. Step 4 then is getting enrolled in Medicare through socialsecurity.gov and getting your Medicare card in the mail. Once you have your card in the mail, then you can go ahead and do step 5, which is enroll in the specific plans you chose in step 3. So 5 steps. But Jeremy, I just said there were 5. I just said 5, right? You're enrolled after step 5, but you are not done because I said there were 6. The 6th step is reviewing your coverage each and every year for the rest of your life. Putting Medicare coverage on autopilot is the same thing as giving an insurance company a blank check. Why would you do that? Don't do that. Review your coverage each and every year.
And when is that time frame? When's the best time to start reviewing that coverage?
So open enrollment, Medicare's open enrollment period happens every year, October 15th through December 7th. Please, pretty please, October 15th through December 7th, take a look at the coverage that you have, Part D drug plans or Medicare Advantage plans, and actually compare the plan options that you have. The plan you have may have worked great for you this year, but when you choose a Medicare Advantage plan and a Part D drug plan, you only have a 1-year contract with that company. The plan you have is for this year. They will send you a new contract at the end of September. In that new contract, they can change everything about that coverage: premiums, deductibles, out of pocket costs, the pharmacy networks, the provider networks, the requirements or hoops you have to jump through to get healthcare services or medications. They can change everything about that coverage while keeping the same plan name.
Hmm.
So the coverage that you have this year may have worked well for you this year, but it could be an entirely different plan with exactly the same name next year. It is super important you review your coverage October 15th through December 7th.
That's kind of crazy. You said that your Medicare choice at 65-ish. We'll go with ish because it's not exactly 65 for everyone. It could be like a lifetime decision, but the insurance companies don't have a lifetime decision. They get to change things once a year if they want to.
Right. So yeah, and that's what's good to clarify about that is you're choosing a path for the rest of your life.
Hmm.
So, original Medicare with a Medigap policy and a Part D drug plan. Within that path, you will be reviewing your Part D drug coverage each year and choosing from different Part D drug plans. So, you are not potentially diverting from that path. Medicare Advantage. When you choose the Medicare Advantage path, you are reviewing different Medicare Advantage plans available to you. But again, very much not likely will you switch paths, because switching paths requires very often that you go through medical underwriting. Medical underwriting means that if you are on the path of Medicare Advantage and want to go to the path of original Medicare, you may never be able to get a Medigap policy to help you cover the costs on the path of original Medicare. The only way you will potentially get a Medigap policy is if you successfully go through medical underwriting. You have no serious chronic conditions. You have no history of cancers or major surgeries. Will that happen? I don't know. Depends on your health. You may be able to change paths during open enrollment, but very likely people 65 years of age and older only want to change paths when things are going wrong. And when things go wrong in healthcare means you have serious healthcare needs. You have issues. You're not changing paths.
Yeah, I love how you said that. I've been saying that for years. It's like if you're on Advantage and you want to switch over to supplement, you probably only want to do that because you want more coverage, better coverage, something different, and you only want that because you had a health situation. So hearing that from you means I've got it right for at least the last few years. I'm happy to hear that.
Right? Yeah.
Yeah,
Medicare, typically, in my experience, Medicare Advantage works until one day it doesn't work. And then
yeah,
when it doesn't work, that's when you want out but cannot get out.
yeah. Well, that's
Remember,
tough
you are
to
making that path decision for life.
hear because especially when you turn 65, it looks all rosy with Advantage. You get free this, free that, free insurance, free gym memberships. Tell me about that and
On the freebies.
yeah, tell me about the freeways and what we
Sure.
should really be keeping in mind.
So I love it. Okay, first and foremost, there are two things that make Medicare Advantage plans so attractive to so many people. The first thing is 5 words. Those 5 words are $0 in monthly premiums. 5 words. Notice I did not say one word, free. I did not say
Mm-hmm.
free. I said $0 in monthly premiums. The insurance companies would say free if they could. By law, they cannot say they are free because they're not. So don't translate $0 in monthly premiums into free in your head. They're not
Mm-hmm.
free. They just happen to have $0 in monthly premiums. Okay. The second thing that make Medicare Advantage plans so attractive are exactly what you said, Jeremy. Free dental, free vision, free gym memberships. Get all the benefits coming to you. Okay. Thank you very much. By the way, Joe Namath is off the air, and sayonara. Good riddance. I'm so glad he's pretty much off the air, although he is selling hearing aids now. So
All
you
right.
will still see him. Anyway, so those free benefits sound really nice until you actually start getting into the details. So, Jeremy, when I say to you free dental, what do you think?
Well,
What
free
does
dental
free
insurance.
dental mean to you?
Everything's free.
Right. So I have had people call us up and say, hey, I'm on one of those Medicare Advantage plans with free dental. I just got a bill for $3,000, but I have free dental. Can you help me get this cleaned up? All right. So your human definition of free does not equal the Medicare Advantage plan's definition of free. So let me tell you what the difference is. When I say free dental to human beings, they think, oh, that's great. I'll get crowns and bridges and
Mm-hmm.
extractions and dentures and whatever I need whenever I need it. Ha! That is not the insurance company's definition. The
Mm-hmm.
insurance company's definition begins and ends with something called plan limits. Plan
Mm-hmm.
limits put a cap annually on the total amount of benefit you will get in any given year. When it comes to Medicare Advantage plans and dental benefits, 60% of plans cap dental benefits annually at less than $1,000.
Mm-hmm.
One crown is $1,200 to $1,500. You're not getting one crown, much less crowns, bridges, extractions, dentures, root canals. Not, no. Maybe you're getting 2 cleanings and a series of x-rays. Maybe. But that is not what people think of when they hear free dental. The free eyeglasses that they talk about, I would really like to know where they shop because, as you see, I'm wearing some. The last time I got eyeglasses, they cost me about $480.
Mm-hmm.
The national plan limit average for vision on Medicare Advantage plans is $160. So that's this part of my
Mm-hmm.
eyeglasses. It wasn't nothing, but it certainly isn't helping me see anything. So the reason that I bring this up is because Medicare Advantage plans lead in their marketing with all of these extra benefits. Get
Mm-hmm.
all the benefits coming to you. Well, it turns out they ain't all that. But the reason that they lead with this is so that you take your eye off the ball. What do I mean
Mm-hmm.
by that? The reason any of us have health insurance are for the things we know that will absolutely bankrupt us if they happen to us. Cancers, strokes, heart attacks, serious car accidents, major surgeries. If those things are not appropriately covered, but you have a free gym membership, what the heck good was that insurance?
Mm-hmm.
So make sure that you get the scoop of ice cream before you throw the sprinkles on it. And that's what I call these free benefits. They're sprinkles, but short of 5-year-olds, I don't know anybody who is craving just a pile of sprinkles with no ice cream. So make sure you have the scoop of ice cream, which is solid health coverage for cancer, strokes, heart attacks, so that you can go to the hospital down the street that you have relationships within, rather than have to drive 2 hours across town to meet with a doctor who doesn't know you from Adam. Make sure that the big things are covered. Then you can start looking at the sprinkles.
Yeah, it's worth thinking of, especially that's exactly it with insurance. You got to focus on the big stuff, the stuff that could bankrupt you. But that's all I hear all the time was free Medicare, free dental, and I've been harping on dental for 20 years because it's just nuts. Like you turn, and I actually I can't blame you because you work for 35 years, 40 years, and a lot of companies either give you free dental insurance, right? It's just part of your compensation, or they pay like 90% of the cost. So you're paying $5 a month, something like
Mhm.
that, just to get your free dental. Although you think you have free dental, look into your current employer plan. That probably has a $1,500 max,
Right.
is what I see most of the time. So it's really not even that great compared to what you think it is. I've heard people that say, "Well, how can I afford to go to the dentist?" Well, you make 100 grand a year as a retiree. You can pay $100 to go to the dentist. Or
Right.
I've heard people like, "Well, if I don't have insurance, how do I even go to the dentist?" Like, dentists hate insurance. They would much
Yes.
rather you actually write the check. Every time I go to the dentist, they're encouraging me to drop my insurance and just say, "Hey, we'll do our discount plan, and it'll be cheaper to
So
go just
seriously,
with our discount plan."
Jeremy, look at that. And that's what I say to people. Dental insurance, and this is my standard answer. Dental insurance is a joke. It really is. Just look at how much you actually pay. Ask your dentist how
Mm-hmm.
much the services that you need year in, year out typically cost. Ask them if they have their own discount programs. Check into Dental savings plans. Fun fact, nobody knows what dental savings plans are. Forget
Mm-hmm.
dental insurance. Look at Google dental savings plans. What dental savings plans are is essentially like a dental version of a Costco membership.
Mm-hmm.
You take one annual membership fee. Let's say it's about $120. Then with that membership, you see a doctor who will accept the savings plan. In that year, you get a series of discounts, typically 40 to 60% off the cost of the service. It's not insurance. The discount applies to all services. Will you save at least $120? It's very easy to do the math and see,
Mm-hmm.
well, if I just have 2 cleanings and a series of x-rays, I'll save $150. Done. Now, if it turns out you need a root canal or a crown, you're saving $600 to $800 per service. Yes, please and thank you. No maximums, no deductibles, no crazy monthly premiums. It just makes so much more sense, and the math is so much easier and adds up a lot better.
Mm-hmm. Yeah, we've been harping a bit on dentist, free dental insurance, but that's all I hear is free dentist, and it's just not even close to true.
Not even
So
close.
we got to talk about it. It's the number one thing I think people are talking to me about with Advantage or Supplement or Medicare or what. Medicare doesn't cover dentists, so what am I supposed to do now? There's a lot to do. We went down what to do there. I want to go through the kind of the two paths of Medicare, why you might choose one or the other. Before that, though, I want to talk about you mentioned a word a little bit ago, selling. Why not go straight to the Medicare insurance salesperson? Why not just have them kind of help you figure it out?
All right. So I do. Please, before I get into this segment, please know that I do know some very good Medicare insurance sales agents. I do know some good ones, but I also know some bad ones, and I have heard a ton of horror stories. So they don't wear labels. They don't walk around with white cowboy hats and black cowboy hats, easily distinguished between the good ones and the bad ones. So, what's important to know about Medicare insurance sales agents is the fact that they are employees of the insurance company. They work for the insurance companies that whose products they sell. That is their first and main obligation. An insurance agent is not paid anything until they sell you something from their portfolio. Do they sell everything that's available? Absolutely not. You want their sales portfolio to be as wide as possible, but did you ask how many companies they represent out of the total number available in your area? Ask, find out, because if they only represent 2 of 10 companies that sell plans in your area, the chances are pretty low that you are going to get the policy that is in your best interest. Ask. Ask if they sell Medigap policies, which is a part of the original Medicare path. The original Medicare path is the US government as your health insurer, the Medigap policy to cover the costs that Medicare would have left you paying, and a Part D prescription drug plan. So that's the path of original Medicare. So on that path, you purchase a Medigap policy. If you choose the path of Medicare Advantage, you choose a Medicare Advantage policy. So ask them, do they sell both Medigap policies and Medicare Advantage plans? Some agents only sell Medicare Advantage plans. Guess what they're going to sell you? They're going to sell you a Medicare Advantage plan, even if that isn't necessarily in your best interest, because that's the only thing they sell. Ask, do you sell both types? One of the lesser fun things to ask about is how much you are compensated based upon what you sell. So sales agents typically make about 40% more in the initial commission, the first year's commission, selling a Medicare Advantage policy than a Medigap policy. Over the lifetime of you being enrolled in Medicare, if they sold you a Medicare Advantage plan and you happen to live for another 20 years, they will make a commission, a renewal commission, every year that you are on that Medicare Advantage plan for the rest of your life. If they sold you a Medigap policy, they will only make a renewal commission for 6 years. Medigap policies stop paying renewal commissions after 6 years. So let's take a look at this. I make 40% more in the initial commission selling a Medicare Advantage plan, and I will make renewal commissions for as long as you live and remain on that plan. That's $6,000, $7,000, $8,000. If I sell you a Medigap policy and I only get commissions for the next 6 years, that's anywhere between $2,000 and $3,000. You tell me fiscally what I want to sell you. And if it turns out it's a heck of a lot easier to sell you a $0 monthly premium plan with free dental, free gym membership benefits, than it is to sell you something that has a monthly premium and covers the costs of original Medicare, that's a lot less sexy sounding. So I'm going to sell what's easier, faster, and more lucrative for me to sell. So ask what they sell. Do they sell both types? How many companies do they represent? Ask them what percentage they sell. Do they sell 90% Medicare Advantage and 10% Medigap policy? There's a good chance that they are trying to steer people one way or the other. Ask these questions. That's how you determine a good agent from a bad agent. They will not wear name tags.
Yep, I suppose, and that's a big important thing of, especially if you think the first step is picking a plan, which we've learned is not the first step. Although sixth step is reviewing your coverage, and I heard you say that the this year is a big year for Medicare open enrollment. So why would you say that the 2024 Medicare open enrollment period is the most important one ever?
Yes. In fact, that's so important. Those words are so important. I'm going to repeat them because
All
repeating is
right.
key to learning. 2024 is the most important Medicare open enrollment period in Medicare's 59-year history. The most important. Why? Okay, so Jeremy, it's already pretty clear I'm a little loony. So I'm going to double down on the loony right now. When I tell people why this is the most important Medicare open enrollment period in Medicare's history, at first people are like, Melinda, that sounds amazing. Okay, so I will show you. The reason that this is the most important Medicare open enrollment period in Medicare's history is because the Inflation Reduction Act stated that come 2025, all Part D drug coverage must put into place a $2,000 out-of-pocket spending limit for drug costs. A $2,000 spending limit for drug costs is great, right? Like, I used to have to pay $3,000, $5,000, $8,000 a year in copays for my medications. You're telling me that next year the most I will have to pay is $2,000? But you're saying it's the most important Medicare enrollment period in Medicare's history? What's wrong with you? Okay, well, that's not what we're talking about today. But the reason why is because ultimately, when a person hits the $2,000 spending limit, the medications don't magically become free thereafter. Somebody has to pick up those costs. Who is picking up those costs? That's where the dirty secret lies. In previous years, after people hit typically about a $7,000 to $8,000 spending limit, so a person would spend $7,000 to $8,000 in medication costs over a year, then they'd hit what was called catastrophic coverage. In catastrophic coverage for the rest of the year, the cost of the medication would be split like this. Seniors would pay 5% of the total cost of the medication for the rest of the year. Medicare would pick up 80% of those medication costs, and Part D insurance companies would pick up 15% of the costs. Okay. Come 2025, we are dramatically shifting that. First and foremost, we are dropping the spending limit from about $7,000 to $8,000 to $2,000. That means somebody has to jump in to pay the costs a lot sooner. Okay. Then, after a person hits $2,000, the government, in their very wise wisdom, is assuming that Part D insurance companies instead of paying 15% after $7,000 or $8,000, will now pick up 60% of the
Mm.
drug costs after the $2,000 spending limit is reached. They used to have to pay 15% after a $7,000 spending limit. We are now saying they have to pick up 60% of the cost after a $2,000 spending limit. How many people in the room think these Part D insurance companies are going to happily take a $4 to $8 billion hit? Anybody? And no, nobody ever raises their hand unless they're being funny, right? Like, oh, I do. No, you actually don't.
Mm-hmm.
So they are going to pass on these costs. How are they passing on the costs? Three ways. First and foremost, plan premiums are going to increase. We saw them increase overall 23 to 25% between 2023 and 2024, which was the phase in year for this 2025 spending limit. So just in that year, they increased about 25%. We expect plan premiums to increase overall 25 to 50%
Mm.
next year. Second thing that they're doing is increased cost sharing. It's not a big deal if your zero copay for a very generic, boring medication turns into a $3 copay, or if your $5 copay turns into a $10 copay. It's not really a big deal, but it becomes a much bigger deal if your copay turns into a co-insurance. So let's say you're taking a drug like Eliquis. Eliquis is a very common brand name blood thinner. Eliquis has a retail price of about $590. If your $47 copay, which is typically what it was in years past, if your $47 copay turns into a 25% coinsurance, now your copay is about $150 a month.
Mm.
That's a much bigger deal. So copays are turning into coinsurances. But even that's not the real story. The real story is the third way that they are going to pass on costs. The $2,000 spending limit only applies when your medications are covered by your Part D drug plan. Guess what? Part D drug plans don't have to cover all medications. If your medication was covered this year, it's no guarantee it's covered next year. Plan formularies. Formularies are the list of medications that Part D insurance companies cover. Formularies can change and do change each and every plan year. A medication that's covered this year may not be covered next year. If your medication is not covered next year, you will pay the full retail price of the medication, regardless of any $2,000 out-of-pocket spending limit. I have clients with medications that are $20,000 to $35,000 a month. I
Wow.
have a client surviving right now on a stage 4 cancer medication called Tagrisso. Tagrisso was covered in 2023 by 16 of 22 drug plans in her area. Come 2024, again, this was the phase-in year for this year. Only 2 plans out
Mm.
of 22 covered this medication. I am very fearful come 2025 that no Part D drug plans are going to cover this medication. And this is one of those medications that costs $34,000 a month.
Wow.
What is she supposed to do? I mean,
Yeah.
literally, she's surviving stage 4 cancer based on a medication that there isn't a very good alternative to. It's not like
Mm-hmm.
she can just go switch. Switching for her may be the end of her life.
Mm.
And if she can't afford it because it's not covered, again, the end of her life? I don't know. So
Yeah.
very, very important. If your medication's not covered, no $2,000 spending limit will apply.
Yeah, it's an easy soundbite to say you don't have to pay more than $2,000 when the unintended consequence, although seems pretty obvious to me that if you tell the insurance company you have to, quadruple the amount of coverage or
Yep.
on this one area, well, they got to change it somewhere else. That seems pretty
Yeah,
I
it's
don't
a
know,
no-brainer.
economically
And
sound.
that's,
No brainer, exactly. All right, well,
yeah,
we want to
that's,
get people on the right track for their Medicare, and you said that the timing is a big piece of it. I've got a YouTube video I'm going to link to that talked about the different timings with the initial enrollment period, special enrollment period, general enrollment period. So we're going to cover it there. I'll link to that in the show notes and the comments. But let's talk about this path of Medicare and
Mhm.
make sure that you're headed down the right path. So how do you choose between Medicare Supplement and Medicare Advantage?
Okay. So basically, again, what I like is the visualization. So imagine that you're standing at a fork in the road. Okay, we're going to build out both paths. So first, we're going to talk about the path of original Medicare. So the path off to the left, although you may be seeing this and maybe I'm going backwards and I'm off to the right, whatever. Anyway, we're going to go one way. So the path of original Medicare, basically the first thing we do is we put the Capitol building in the background. So way back there in the background, we put the Capitol building because this is the government's path of Medicare. The government serves as your health insurer on this path. They are making the rules, deciding what's covered, what's not covered. They are setting the networks. Fun fact, Medicare doesn't really have networks. Providers across the country who accept Medicare are in your network. Hospitals across the country that accept Medicare are in your network. Basically, you can go anywhere to see any doctor or go to any hospital that accepts Medicare. That's a big deal. If a provider says you need something, almost as a rule, almost, because the only thing in Medicare that is true for everyone is nothing in Medicare is true for everyone. Almost as a rule, though, if a doctor says you need a medical service, Medicare will cover it without prior authorization. So you don't, for the most part, have to go get permission from the government to get a healthcare service. Your doctor is in charge of what you need. So that's the path of original Medicare, the first bit. Okay. The government is in charge. The government's Part A hospital coverage and Part B medical coverage, though, have costs associated with them. If you only have Part A and Part B, you will effectively pay 20% of every bill with no spending limit in sight. 20% of cancer, 20% of major surgeries or a heart attack. Ouch. So on this path, you add two additional pieces. The first piece you add is a Medigap policy, also referred to as a Medicare supplement. Please, supplemental coverage. Don't ever use that phrase again, because typically
All
when
right.
people say supplemental coverage, they are referring to a Medicare Advantage plan. Insurance companies are doing this on purpose to confuse people with the terminology. A Medicare Advantage plan and a Medigap supplement have nothing in common. They are two completely different things. So, a supplement, Medigap supplement is not health insurance. So this breaks people's brains a little bit. A Medigap policy is not health insurance. It has no say in what doctors you see, what services you get. No. The only job of a Medigap policy is to cover the costs that Medicare would have left you paying. It's its only job to cover the costs. It has nothing to do with networks. It has nothing to do with healthcare services. It covers the costs that Medicare would have left you paying. It is cost insurance. Okay, you add that from a private insurance company. The second piece you add on original Medicare is a Part D insurance company, again, provided by a private insurance company. So Part D drug plan provided by a private insurance company. Very often, the Medigap policy and the Part D drug plan will be from different carriers. That is in your best interest. Getting a policy from the same Medigap and a drug plan from the same policy, that's in the insurance company's best interest, not necessarily yours. So take a look at those pieces separately and determine what's best for you. So the package of original Medicare, you get original Medicare A and B provided by the government, the Medigap policy for cost coverage, and the Part D drug plan for Part D prescription drug plan coverage. You pay a monthly premium for Part B, $174.70 a month per person. Medigap policy, national average plan G is greatest coverage. G for greatest is national average is 183. And the national average Part D drug plan premium is about $34. When you pay these monthly premiums, you will have few, if any, additional out-of-pocket costs for healthcare services. Jeremy, you could be in the hospital for 3 weeks, and after you pay your Part B annual deductible, one time $240, you won't see another bill. That's how that works. Very budgetable costs, very predictable approach to receiving and getting healthcare services. Okay, there is the other path available to you. So on this path, in the distance, we don't put the US Capitol building because we put a corporate building. When you choose the path of Medicare Advantage, it is very important to understand you are choosing for a private insurance company to be in charge of your Medicare. You do not have the government's version of Medicare anymore. You don't. You are taking a private insurance company's version of Medicare. You have to follow their rules. Now, just to confuse everybody in the room, because we're all about that on Medicare, you have to be enrolled in the government's version of Part A and Part B. But the reason you have to be enrolled in the government's version of Part A and Part B is so that monies get transferred to the private insurance company. The government has to transfer money to the private insurance company to take care of you in a year. The goal of the insurance company is to keep as much of that money as they can, not provide you with health services, but to keep as much in profits. So the insurance companies are in charge. You have to follow their rules to get hospital, medical, and drug coverage. Now, remember, they will basically provide you hospital, medical, and drug coverage, and they will do it under the guise of 5 words, $0 in monthly premiums, and extra freebies, free dental, free vision, free gym membership. Right? So that's the package. But to use that package, you have to follow 3 rules. Rule number 1, networks, 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 networks. Just because you may have a PPO plan, Medicare Advantage plan, does not mean you can necessarily see out-of-network providers. This is a big change now in the last 2 years. Providers who are out of network have no obligation to take out of network coverage. And as a result, since 2023, we are seeing this all over the country. Scripps in Southern California, Baptist in Kentucky, Nebraska Health in Nebraska, Mount Sinai in New York City, Mayo Clinic. Basically, what they are saying is if you have Medicare Advantage, take it somewhere else. We will not see you in or out of network. So networks are a big deal, and networks can change at any time. Providers in the network now may not be in the network 3 months from now when your surgery is scheduled. Rule number 2, prior authorization. And this is a biggie. Prior authorization is basically everywhere on Medicare Advantage. The rule of thumb is if you want to do anything other than see your primary care physician, the insurance companies can ask for prior authorization, meaning that your care will not necessarily be tomorrow. You have cancer, just diagnosed with cancer, you need chemotherapy, you're going to be waiting around a bit to decide, for the insurance companies to decide whether or not they think you need chemotherapy. Skilled nursing facility stays. This is a big one. This is a big one. I am seeing denials all over the place. You're 90 something? No, we don't think you need skilled nursing rehab. I mean, what are you going, you think you're going to get better at 95? No, we don't think so. So we're not paying for it. So they can and do deny services. Your doctor is not necessarily in charge. They may say you need something. The ultimate decision comes down to a mother, may I request? Mother, may I get the shoulder surgery? Mother, may I get skilled nursing care? They may say no, and you can try to appeal it. Appealing is going to take time. Time when you have cancer, when you've had a stroke or a heart attack, time can be everything. So prior authorization. And last but definitely not least, rule number 3, whenever you use healthcare services, you pay something. So when you're 65 and typically pretty healthy, you may pay nothing. But by the time you have cancer, you're having strokes, heart attacks, whatever, get to know what the maximum out of pocket spending limit is because you are likely to hit it. If you don't get prior authorization, don't see providers who agree to take out of network coverage, you pay the whole bill, regardless of any spending limit. So the 2 paths are really, They are the mirror opposite. Original Medicare is monthly premiums and then little or no out-of-pocket costs for healthcare services. Medicare Advantage is $0 in monthly premiums, but you do still pay the Part B premium, $174.70. So $0 in monthly premiums for the Medicare Advantage plan, but then you pay every time you use healthcare services. How much you'll pay, I don't know. I don't have a functional crystal ball. So there you go. Those are the two decisions.
Yeah, it's interesting because you think a lot of times it's, am I choosing Medicare supplement? Am I choosing Medigap versus Medicare Advantage? And what you're telling me is, no, your choice is actually, do I go with original government Medicare and all the nice things I might hear about that, or do I go with private corporate Medicare, which could have nice things along with that? The zero premium monthly, zero cost monthly premium is number one, I would think.
Right. But
Yep.
then what happens if you need care? And
Right.
that's typically what we find. Medicare Advantage works well until one day it doesn't work.
Mm.
And then what do you do? Because when it doesn't work is typically when you have cancer, you've had strokes, heart attacks, things are broken. How are you
Yep.
going to get fixed when the care isn't working?
You got it. Well, there's a lot of things that hopefully you can do ahead of time. You've got a few places, heymo.com and i65.com. Tell me a bit about those.
So I-65 is actually synonymous. So i65.com, it's the road to Medicare. You like it?
Yep.
i65.com and 65incorporated.com, because 65 is the age that Medicare starts. 65 incorporated, all spelled out.com. So those are the two companies that basically introduce our software program. So we do have a software system that typically helps professionals help their clients make good Medicare decisions. It works on a fee for service basis. Again, it is not related to the sale of insurance. But in addition to the software, we have one-on-one consultative services on a fee-for-service basis as well. So we typically work with consumers off the street. We work with financial advisors and their clients. We work with employers and their employees who are retiring to basically make sure they are making the best Medicare decisions for their unique needs. And sometimes that means they're not getting enrolled in Medicare at age 65. Sometimes that means even though they're still employed, they are getting enrolled in Medicare. It all depends on a person's unique situation. So those are those two services. They are really about making the right Medicare decisions. Hey Mo is a brand new service this year. Hey Mo, Mo is MOE, and it stands for Medicare Open Enrollment. Hey Mo. The goal of Hey Mo is to be a reminder and review service that makes it very easy for a person to know, is their Part D drug plan for next year still the best plan for them, or would it be best for them to change? We go through every plan that's available, and we take your prescription medications and go through every plan available in every pharmacy. And we tell you what your lowest total cost combination is. Hey, it looks like instead of being on WellCare such and such a plan, you should switch to the Humana such and such a plan. And instead of using the Walgreens pharmacy, use the CVS pharmacy. I don't know. I'm making this up off the top
Yeah.
of my head. But the point is, we tell you too how much you will save. It looks like you'd save $1,000 next year by making these changes. Do you want to do that? The beauty of HeyMo is you don't have to remember when open enrollment is. You don't have to know where to go to compare plans. You don't have to know how to compare plans. We do it all for you. So the only thing we ask you to do is sign up and give us your prescription medications in our easy to use login app. Once you do that, we take it from there.
Yeah, it's helpful. It's like I said, things are changing every year. This seems like a big year for change on the open enrollments, the Part D specifically. I want to make sure we have links to all that, the heymo.com for the open enrollment, the 65-incorporated.com to get expert guidance from someone who's not going to sell you insurance, but help you find the right path, find the right insurance for you. You've got some YouTube videos out there. I'll put those out as well
Yeah.
too for you. You get some lot of good information that Melinda's sharing. I've got one final question for you,
Yes.
but before that, I want to show this book. I read this book just recently. I think you know the author there. It's your
I
mom
know the author
and
there.
co-founder with 65 Incorporated. This
I've
great
known her all my
resource.
life.
Yes, yes, she has. So Medicare for You, a smart person's guide. First three people that reach out to me, it's podcast at Keil FP, podcast at KEILFP.com. I will send you this book because it's just get some more wisdom from. You're going straight to the source, I guess. Go up a level to Diane, your mom. How's that sound?
No, that sounds awesome. And I admit, she is the Medicare queen. I'm oh God, I hate that. I'm not the Medicare princess. Oh
There you
God.
go. That's funny. That sounds like some new branding at the Medicare Queen and the Medicare
No,
Princess. Yep.
no. In fact, it's funny. I just started a new video series on TikTok. I can't even believe I just said that. But I'm Medicare in leather. I
Medicare and
am no
leather.
princess. I am no princess.
I agree. It's great. That's awesome. Of course, we're in Milwaukee. You're also kind of North Milwaukee, I think. So
I am.
so
I am.
so you're
So Harleytown.
it's you're in Harleytown, which is good.
Right.
Well, my final question for you, Melinda, is tell us something about yourself that few people know about, and remember this podcast is rated clean.
Oh, absolutely. So, fun fact, I teach drawing and painting to kids in my free time. So, I have a lot of, I love drawing and painting, and I don't sell anything, but I've been known to paint shoes for people. I have been known to just give away paintings and artworks.
Oh,
But
that's great.
one of my big joys is teaching kids. Typically, they range in age from about second grade all the way through high school. I teach them drawing and painting, and I call them my kids, right? They're not technically my kids,
Yeah,
but
right.
for a couple of hours once a month, they're my kids, and I love them to death. And watching them discover, oh my God, I can draw. Who knew? I did. I
Yeah,
did. I just had to show you how.
that's right.
So that's
Mm-hmm. Well, drawing is a skill I don't believe I have.
oh,
So
there we
maybe
go.
next time we see each other in
Do a
person, you can
podcast
help me out
on
with that one.
basic drawing. Yes, you can.
That's right. Awesome. Good. Well, thanks for coming on and sharing a lot of wisdom about Medicare enrollment, Medicare in general, and the upcoming most important Medicare open enrollment of our lives here in the fall of 2024.
Awesome. Thank you.
Thank you, Melinda, and thank you for listening to the Retirement Reveal podcast. We believe if you know more about your money, you will feel better about your money and you will make better money decisions. Hi, I'm Jeremy Keil, owner of Keil Financial Partners. And if you're interested in seeing how we help our clients get more income, pay less in taxes, and avoid big retirement mistakes, make sure to go to KeilFP.com. That's KEILFP.com.